I can tell you that very briefly. I retired as of June 30th. So I made the decision, close to 30 years of this, and I decided that I was going to end it at the end of this academic year. So I started telling my patients in January, and um, it was unbelievable how heartfelt some of the folks were. My wife was asking me, "Well, how's it going?" And I said, you remember the people that are upset with you. You don't remember the people that are grateful and happy for what you've done for them. So it all went well. I'm only a couple weeks into it now, so I think it's, as friends of mine have said, it's more like a vacation so far. You have to kind of do it for a while before you sort out what's going on. Well, I was working in Boston doing research at the Shield Horn Radiation Laboratory and wanted to get back and do medical research and in something in the area that I was doing, which was mostly physics. And I saw that they had a medical scientist training program at Toledo, and that's where I grew up. So I thought, well, this is a good place. And I applied and was fortunate enough to get in and was accepted as a graduate student under Joe Wyndham. Based on the training I had at MCO, now the University of Toledo, I got my PhD and my MD. And my research under Dr. Wyndham was largely in his area of expertise was looking at medical imaging. Dr. Peter Goldblatt was the chairman of pathology, and his dad was Harry Goldblatt at Case Western, who did the initial description of renovascular hypertension. And Dr. Goldblatt showed the video of his dad doing all that. And I thought, wow, that's just phenomenal. The constriction of the renal arteries caused hypertension by all of these hormones. And I went to Dr. Wyndham and I said, this is the thing I'd like to work on. And the head of the nephrology division was Dr. Higgins. And one of his associates, Dr. Joe Nally, took me on and was just invaluable with his time. And he just allowed me to just kind of sit in his office and shoot the breeze and come up with these different ideas. And we worked through this and came up with this imaging technique, 2 articles and an editorial that were published in the New England Journal. I think it was about 1987. And it talked about this drug called captopril. It was a converting enzyme inhibitor that blocked one of those hormones in that system that Goldblatt described. And the patients, those that had stenosis on both sides or stenosis to a solitary kidney, went into renal failure. And if you stopped the medicine, the kidney function came back. So I said to Dr. Nally, I said, we could do this in our animal studies. We could do this. It'd be a provocative test. It'd be great. And he said, well, no, not necessarily. It wouldn't necessarily be great. We need to study it. And under his direction, I applied for and got NIH funding to look at this. And we found that it was significant, and it's used internationally now. It's not the same drug, but a provocative study to pick this up, which was, I'm just really proud of that, because it was kind of a home run by accident, I was somewhat surprised, but I have been back to Toledo several times to do grand rounds. And one of my former residents is on the faculty there. He's the residency director in the urology department under Dr. Sinwana. And I kind of figured out where this came from. I'm sure that the input came from the department there to propose me for it. So surprised, but I've kind of figured out where it came from. I think it's a great honor. I'm sure that there are people that are far better credentialed to receive it, but I'll take it. Figuring out the converting enzyme renography will always be one of the biggest things, but also, I was dean, graduate medical education dean and DIO of the Medical University of South Carolina for 10 years. And I put, I had 1,200 residents and fellows under my auspices, and I put us through 2 ACGME accreditation reviews with glowing reviews 2 times, and those are not easy things to stumble through. So I'm very proud of that as well. At MCO, University of Toledo, I found it to be an incredibly collegial place to work and to learn. My co-residents were phenomenal. I keep in touch with a number of them. Uh, we would. This was before the duty hours came in, so we worked long, long hours and shared a lot of our trials and tribulations. So it was a very supporting group. One that comes to mind, which I probably shouldn't share, when I was a student at MCO, and Dr. Wodarsik's wife, Kathy Wodarsik, was a pediatric resident at the time. She was a senior resident and she was doing rounds. I was one of the students on the service, and we were up in the MUSC hospital with beautiful architectural band wings. And at the time, Kathy was going on and explaining these very sick patients and the differential diagnoses and things. And we're brand new third-year students in our short white coats and so forth. And I'm looking behind her, and they had removed all of the carpeting and were putting down new carpeting. And they had laid out glue all over the floor. Out, this is just beyond us now, to her back. And there was a neurology fellow, a very brilliant guy, engrossed in a chart. Now, this is back before Epic, so we had charts. You had all of the records in a chart, which you had to run back and forth up and down the floors, excuse me, to get the data that you needed. He was engrossed in this chart and on his way to the patient's room. Now, this is across from us to Kathy's back. And he was about 15 feet out in this glue when he realized, with the swishing noise of the glue coming up around his shoes, what was going on. And I was just biting my lip. I could hardly breathe. I was about to laugh because I was thinking, he's just realizing he's got to turn around and walk back through all this glue. To this day, I think she's amazed that I was able to graduate from medical school, because she just couldn't understand my lack of sincerity on rounds. Joe Wyndham was just a phenomenal individual. He was a physics and mathematician, and was dependent upon the clinicians to help him with the pathophysiology and things, and was just great at getting me in touch with and able to work with some of these other people, and promoted my doing these things that I wanted to do for my PhD thesis. And Joe Nally, I still keep in touch with. He was just a phenomenal mentor. He was there at MUSC at the time, then went on to the Cleveland Clinic. And then during my residency, at that time, Dr. Ken Kropp was the chair. Dr. Stephen Selman and JJ Junjanwala, they were the three. They did all the transplants, so we did all that. Dr. Kropp did everything. I mean, he was a MASH surgeon in Vietnam, and there wasn't anything that he was not willing to tackle. It was just phenomenal. And you never hesitated in asking these guys a question about anything. Everything was on the table. So it was wonderful. As the associate dean, every year when I brought in the new set of residents and fellows, I would have the president of the South Carolina Board of Medical Examiners come in and present a talk to these people about the do's and don'ts of having a medical license, what you're allowed to do and what you're absolutely not allowed to do. And I would give them a talk about the fact that they're going to be the teachers now, and it's real important for them to think about things in this way. And what I would say is, if you think back and remember that resident that you worked with as a medical student, who you'll remember forever, that would sit with you and talk to you and explain things, and you just felt that they were invaluable. And then think of a resident that was kind of nervous and was sharp or critical, and one that you couldn't wait to get away from. And what you want to do is try to be the former, not the latter. And the reason for the difference is the former is probably been there for a little bit, is more comfortable in their own skin. They know what they're doing, so they're more relaxed and by that, more available. The other is probably nervous about doing the wrong thing. They're just starting out, and it's going to take them a while to get to the better place. So that's what I tell them when they come in, and that's kind of what I'd like to be remembered by. I love it when a resident calls me and said, "Hey, I did this case. It was even harder than that one that you showed me how to do. And I think it turned out even better. And I love to hear from my residents about what they're doing and how they're doing, or if they have a question about a case. I've got this guy in and he's got X and it's huge and it's a big deal. What would you do with him? And I said, oh, I'd send him to you because you really know how to deal with this.